Welcome back to Scalpel and Scribble, your trusted space for high-yield, exam-focused, and clinically relevant medicine. Today, let's talk about acute pancreatitis, a condition every medical student, intern, and doctor must know inside out. Acute pancreatitis is essentially inflammation of the pancreas. The two most common causes are gallstones and alcohol. Gallstones contribute to about 45% of cases, while alcohol is behind nearly 35%. Drugs like azathioprine, 6-mercaptopurine, and some antiretrovirals can also trigger it. Very high triglycerides and high calcium are important metabolic causes. Vascular problems like ischemia or vasculitis, and even hereditary factors like cystic fibrosis may also play a role. Patients typically present with severe abdominal pain that radiates to the back. The pain is usually in the epigastrium and gets worse after meals. Nausea, vomiting, and sometimes jaundice are common complaints. On examination, the abdomen is often tender. For diagnosis, the most useful blood tests are serum amylase and lipase, with lipase being more specific. Amylase may return to normal if the patient presents late. Liver function tests can suggest gallbladder involvement, and triglyceride levels should always be checked. A CT scan is the investigation of choice to assess severity and look for complications such as necrosis, pseudocysts, or fluid collections. Ultrasound is especially useful for detecting gallstones. Management begins with aggressive fluid resuscitation and correcting electrolytes. Pain relief with strong analgesics is vital, and severe cases may require ICU care. In patients with necrotizing pancreatitis seen on CT, antibiotics like imipenem may reduce the risk of sepsis. If gallstones are responsible, ERCP may be required to clear the obstruction. Nutrition is important. Initially, patients are kept nil per oral, but once stable, enteral feeding is preferred over parenteral. Complications can be early or late. Early ones include shock, renal failure, and ARDS. Later on, patients may develop infected necrosis, hemorrhage, pseudocysts, ascites, or fistulas. Prognosis is generally good in mild cases with complete recovery, but severe pancreatitis can be life-threatening. Scoring systems like Ranson's or Apache 2 help predict outcomes. So to sum up, quick recognition, supportive management, and addressing the underlying cause are key to improving survival. And that's it for today's topic on acute pancreatitis. If you found this helpful, don't forget to like, share, and subscribe to Scalpel and Scribble for more high-yield medical learning. See you in the next video.